Happy New Year and welcome to the fourth episode of Perspectives Live and the first in 2022. This is a Colleges and Institutes Canada web TV show where we talk about and share different perspectives on what matters to you. Today's episode explores inside the mental health shadow pandemic. I'm Manjula Salvaraja, your host for this season, and I wish to acknowledge that this episode of Perspectives Live is being produced and broadcast from the traditional and unceded territory of the Algonquin Anishinaabe Nation. Before we get started, we would like to recognize the ongoing contributions of CICAN's corporate partners, Avis Budget, BGIS, Field Effect, and TD, who support CICAN's activities, including bringing you this show we're meeting on, Perspectives Live. Now I'd like to invite the President and CEO of CICAN, Denise Amiot, to join me for a quick chat. Denise, it's so good
Hello,
to see
Manjula.
you. Hello, how are you?
Fabulous, despite the snow.
Despite the snow. Well, I'll tell you, just to kick off this year, the show for this year, what an important topic we're addressing today, isn't it?
Yes, it is a crucial topic. Manjula, with the pandemic continuing, uh, well being and mental health, it's at the forefront of the concerns of our society, and in particular, post secondary institutions. And the post-secondary institutions, it's their responsibility to identify the difficulties and the needs of students because, they are facing isolation, anxiety, some of them is depression or substance abuse. We know that some have physical disabilities or all kinds of inequalities ranging, from social, racial, or gender, of a gender nature, or other adjustment difficulties. And so it's important, we feel, that we talk about the solutions and we talk about this important topic.
I mean, we're definitely going to be talking about solutions today, but I wonder, I mean, given the additional stressors that are caused by the pandemic, I imagine that post secondary institutions are working harder to provide student, staff, faculty with the tools and training to overcome barriers and really to ensure academic success for all. What are you seeing and hearing?
It's not easy, okay? And the good news is that since the beginning of the pandemic, we have seen colleges being very resilient. They came up with innovative initiatives or practices that they implemented across the country to help their students or their staff or even their communities. And this is why our associations, right at the beginning of the pandemic, we created a specific COVID 19 website, if you want. And it's a space that features many of the best practices put forward by our members, colleges, and institutes. And that said, we know that we need to do even more. It's never enough because there are always issues that are popping up. And what's happening, we must continue to share best practices and about how we can provide mental health support to both staff and to students. And this is not only the responsibility of post-secondary institutions. There are many stakeholders that need to be involved, whether it's government, provincial, territorial, federal, it's people from the community, the nonprofit organizations, the employers, because it, mental health is a topic, is a sector that is important no matter where you sit.
Yeah, and you've made such an important point. Well said, Denise. I mean, I think that we are going to talk about the situation on campuses at post-secondary institutions, but really we know that there's so many other factors, trends, and realities outside. Off campus that are also contributing to this. It is clear that a holistic approach is really required to deal with this mental health shadow pandemic, and I'm hoping to hear some of those best practices today from our guests. So thank you, Denise. I will welcome our panelists now, and you'll join us later along with Deborah Saucier, the president and vice chancellor of Vancouver Island University. Thanks again, Denise. It's time now for our panel, and we have a brilliant roster of panelists brought together by CICAN. Let me introduce them. Joanna Henderson is the director of the Margaret and Wallace McCain Center for Child, Youth, and Family Mental Health at CAMH, the Center for Addiction and Mental Health. Liam Hunter is the president of the Students Association of Southern Alberta Institute of Technology. And Simon Lewson is a journalist and author of a recent piece in The Walrus titled Inside the Mental Health Crisis Facing College and University Students. I should add, such a good read. If you have a chance to go find it, you can find it digitally, pick up The Walrus. You'll certainly get a lot of insight from reading that. Joanna, Liam, Simon, good afternoon.
Hi there.
Hi there.
So glad that you can be here for this conversation. Over the next 25 minutes, I'd like to talk about the current picture at post-secondary institutions, the challenges that both people that are in the system and the institutions face in addressing these issues. And then this is really important. I also want to talk about best practices. So Simon, let's start by looking at the state of well-being on campuses right now. Walk us through what you noted in your research for this piece in The Walrus.
Thanks so much. Yeah, I got the idea to write this piece back in 2019, where I had noticed as a university instructor, I teach at the University of Toronto, I noticed that a lot of my students were reporting very high levels of depression and anxiety, and were sometimes unable to complete their work because of these difficulties they were having. And I started looking at the data to see if this was just anecdotal, this is something that I was just seeing in my classrooms, or if this is something bigger. And what I saw was pretty dispiriting. What I saw is just this general trend towards ever greater degrees of anxiety, mental unwellness, extreme loneliness, and suicidality as well, culminating in the most recent bits of data I got from 2019 showing 16% of university students in Canada had reported suicidal ideation in the year that the survey was taken. Something like 70% had reported experiencing overwhelming anxiety. This was back in 2019. This was pre-COVID. And I think I want to point out that the worst that can be said, I think, for COVID is the fact that it has exacerbated a problem that it didn't create. And my goal with this article was to try and figure out what's happening and what we can do about it.
Why do you think that the issue has become so pronounced over the last, let's say, decade or 2 decades?
So, yeah, I was looking at the kind of theories that were out there, and nothing was really sticking for me. There was the obvious social media theory, and I do think that social media can have negative effects on mental health, but laying it all on the feet of social media seemed a bit facile. There's the sort of theory popular in magazines like The Atlantic Monthly focusing on helicopter parenting and this idea that young people are overparented, and this inhibits the formation of kind of resilient lifestyle practices. Again, that seemed like something that was maybe relevant to Atlantic Monthly readers, parents who have kids at very elite American schools. I wasn't totally convinced that explains everything that's going on in our big public Canadian universities. And the theory that I eventually came up with for the article was that really what we're looking at is a series of changes that have happened to post-secondary institutions gradually over the last, say, 60 years that have sort of culminated in the last decade and have made the post-secondary experience very different to what it was. Part of this is the fact that our schools have become much more vocational in focus. There's much more of a stronger sense that a university degree is a prerequisite for a remunerative job. And so an older idea of university as being a kind of place where you take a sabbatical from life and explore the great ideas is sort of giving way to something that's a bit more vocational in focus. Another change is that universities have become much more expensive, in part due to the increase in tuition in the 90s, and in part due to the increase in cost of living since the 2000s. Another big change is that universities have become much more diverse, and diversity is, an unmitigated good as far as our campuses and our campus cultures are concerned. But with a diversity of students also becomes a diversity of mental health needs. And I'm not totally sure that our campuses are fully equipped to to handle the range of mental health needs that our diverse student bodies are presenting today. So all of those things, I think, kind of come together. I don't think there's any one factor. I think it's all those things that sort of come together to make university into a much more high stakes experience than it used to be. It's expensive. It feels like a kind of risky bet. There's a lot of money behind this bet, and the goal is a kind of successful future. And it feels like you're betting a lot of money on that successful future. And this makes the whole endeavor feel that much more high stakes than it probably did 30, 40, or 50 years ago.
And I know that when you're talking about universities, you're really talking about post-secondary institutions. So we're
100%.
talking
Post-secondary
institutes,
institutions.
colleges. I mean, this is the picture. It's interesting because,
That's
you
right.
know, I heard Deborah Saucier, who'll be joining us later. She's a leader at a post-secondary institution, even talk about how the demographics have changed. So Simon, you know, there is something to what you're saying here. That the demographics have really changed. Like a decade ago, the average age of a student at a Canadian campus would have been 19. Now it's 27. And if you really think about that, I mean, and we're not talking here about the volumes of students we're seeing as well. Liam, I'm going to pull you into this. I mean, you have a very interesting on the ground perspective. You're the president of the Students Association. You're also a mechanical engineering student yourself at the Southern Alberta Institute of Technology. What do you make of the picture that Simon's painted?
Well, Simon, you're right. The vocational aspect of it is a big driver of that kind of stress. Overall, the theme that students convey, and I think that students experience, is that it's much higher stakes. I think that change in demographics is a result of a number of things. People feeling more comfortable going back to school becoming a more normal part of life. I mean, we're the most educated population in the history of mankind, specifically here in Canada, and that means that we're much more comfortable going back to school, retraining, upskilling, getting back into the workforce in a different field. I think that the older demographic does lend itself to a little bit more versatility in the workforce, but it also does mean that it can be higher stakes in some cases. I think that higher age number is probably also driven by higher numbers of higher uptake of graduate degrees, as the value of a bachelor's degree constantly is seems to be declining as more and more people pick them up just due to degree inflation. Students are stressed. Students feel like they were maybe sold on an idea that if they got a degree, they would be guaranteed a remunerative job, as was just said. But that guarantee is fading. And there's more and more entry level jobs posted every day that require years of experience, and so we see students spreading themselves thin during their university time. Far from a sabbatical exploring the great ideas, it's very much a case of how many co-ops can I participate in, how many extracurriculars will give me something that I can maybe spin as work experience. It's a much more high stakes game these days.
Liam, you know, there are a lot of leaders in the post secondary space that tune into the show. What's a message, something that you see on the ground that you don't think that they see or may have visibility into that you'd like to draw attention to?
Uh, I think I'll give them credit. I think all of the post-secondary leaders that I work with and that I've spoken with over the past couple years are right there on the ground with us. I think being a student, it's really hard to see it, but being a student leader, it becomes much more apparent. I think one of the biggest revelations that I got when I got involved in student politics, and then of course working closely with the administration, was that schools are run by human beings. I think something that I would really want to see more of is that kind of visibility. Students really don't feel that they're engaging with individuals. They feel they're engaging with a bureaucracy, and when they feel like they're just one of a tens of thousands, which is the case at many of our universities. That can have a really negative impact when they need help during crises. Just having more visibility amongst their students is definitely a big key factor in making sure students feel seen. Making the entire experience of post-secondary more human just makes it more humane. The other thing I'd point out is really to be able to recognize the fact that students are varied and diverse in their means of learning. I think we've been discussing authentic assessment for a long time. That's something that's only become more pressing during the pandemic. I know at my school it's something that we're accelerating because things like online proctoring start to edge into issues of privacy at home really fast. I think we should also recognize that some students genuinely do better online. You will always have a group of students who view this, especially the more vocational environment that we have in post-secondary, as a transaction. They're not interested in that student life the way that the sabbatical of the days of yore really sold us on. They want to come in, they want to get their certification, they want to leave, and if they learn best from home, it's time to recognize that. We need to be holding on to the innovations that the pandemic has forced on us without necessarily forcing everyone to move online.
That's interesting. I mean, you're talking about some of the trends and realities that are not only on campus, but off campus as well, which influence this crisis. Joanna, what are some contributing factors to the crisis to this crisis that you've noted in your work?
Yeah, I mean, I would agree with everything that's been said so far. I think, we really need to think as a system. And when we think as a system, we can see how different pieces come together. It's not just about what's happening at the post-secondary level, but also what leads up to it. And, I think we really need to think carefully about how post-secondary, secondary, and elementary are all working together to keep our youth wellness centered. I think we also need to think about how post-secondary fits in with the broader community as well. We have fantastic initiatives across the country that have been support services that are specifically designed to meet the needs of transition age youth, things like Foundry, Youth Wellness Hubs Ontario, Kickstand. These are community-based initiatives that engage with young people to design services that are tailor-made for post-secondary age students. And so really thinking about how we knit together all of these different pieces of the system. And I think we also need to see faculty as critical members of the system who are challenged on a day-to-day basis with navigating all of the demands that they face. And we need to build their capacity to respond at an individual level as well.
Now, what's interesting is that, you look at the many stages of student life, and, you start right from when someone enters the school system in kindergarten. Is there something that we're missing in the K to 12 or that jump to post-secondary that you think could help?
Well, I'm not entirely sure about something that's missing, but what I would highlight is that we are starting very early on to apply pressure to children and adolescents to see post-secondary as the endpoint. Very early on in the school system, we're socializing young people to do exactly as was described before. You need to join every club, you need to lead the student association, you need to get a part-time job, you need to equip yourself with the goal of getting into the best school, because only if you get into the best school will you have any chance down the road of being successful, from a career perspective. And that pressure very early on, I think, creates this kind of really challenging transition at the end of high school into post-secondary, where young people have an expectation of how things will unfold. And for many young people, it doesn't unfold in that way. They get to post-secondary context, they don't perform as well as they were expecting to perform. They may not even get into the program they were hoping to get into. They may very well, they may struggle significantly, and that high stakes, high risk piece is not talked about through elementary and secondary. And maybe that's a place where we could be doing a better job of really creating more options for young people, validating more options for young people, so that they can feel comfortable pursuing whichever path they feel they'd like to pursue, or that is within reach for them at that particular point in time.
And when would that happen? You see that happening before they get to their post-secondary experience?
Absolutely. we need to, we really need to change the way we think about and socialize and sell the idea of post-secondary to be more inclusive, and to reflect some of what we were talking about before. So going into post-secondary with a whole wide range of goals, and how do we create systems of education that support that range of goals, as opposed to just a really narrow focus on vocational success, career path, preparation for graduate studies, as was said before.
What's interesting, because Simon, I may have this wrong, but I feel like there was a piece in there was a line in your article about it. It was perhaps even said with humor about how parents are speaking or working with their elementary school children to start thinking about post-secondary education, and I had a chuckle about that, like a terrible chuckle. I wasn't happy to read that, but let's, one thing that I found interesting, Joanna, is from hearing you speak before, is that you actually think that there's momentum around this issue right now. What do you mean?
Momentum around, like both in a probably a bad way and a good way. So obviously we are really seeing many more students struggle, and the consequences are significant. We also, however, are seeing more momentum in youth mental health, in that space, thinking about the needs of young people than at any point previously in Canada's history. We have more funders come to the table, more people working together on integrated models of service delivery for young people, post-secondary partnering with hospitals and mental health facilities to think about innovative ways to support young people. We've had more investment than we've had before, and we need more. This is the time. This is our moment in youth mental health. This is really our moment to really change the way we meet the needs of young people, so that they can really achieve their optimal outcomes. And that's been missing in the past.
So with that, I mean, it's the perfect segue to start talking about best practices. Simon, I'll start with you in the work that you did. The sort of the work that you did for this piece. What out there did you think shows promise that post-secondary institutions were trying?
Perhaps my favorite thing, and the thing I think that every post-secondary institution should look at closely, is initiatives to create a kind of single port of entry, one place where students can go to get referrals to mental health services. One of the things that when I would talk to students, is they would always often describe this kind of Kafkaesque experience of sort of realizing that they were struggling with mental health. They would go to one office. That office would turn out, they'd wait 3 weeks to get an appointment. Finally, they'd arrive at their appointment. That office would turn out to be the wrong place. And then they would say, but where's the right place? And the person at that office would say, look, what am I, a tour guide? I don't know. So then they'd go to another office, and that office would also turn out to be the wrong place. And then finally, they'd find the right office, and they'd wait another 3 weeks, and they'd get their appointment. And then the semester's almost done, but they're on a 2-month wait list. So maybe next semester, halfway through next semester, they'll finally get that appointment they need. And it can be like taking an additional course, basically. And you can understand why students who have a full course load and are overwhelmed, perhaps because they're struggling with their mental health, maybe don't have the time and the energy to go through this whole bureaucratic process. And I think the most promising developments have been these sort of creations of these single hubs. You can think of it as a kind of port of entry. This is something that's happening, I think, at McGill and I think at UBC as well, actually, where you go in on the first day, you get an appointment with an advisor, and that advisor is sort of like almost like a fixer who finds out what your needs are and starts connecting you to various services on campus. So somebody else manages the kind of bureaucratic headache of getting the services you need. I think that's huge. And I think another very important piece of those kind of innovations is that they involve making a commitment to see every student on the same day. So you get that initial intake appointment on the day you ask for it. I think that's huge. And I think if there's one thing universities should look at very closely, it's that. The other thing that I find interesting is more culturally sensitive models of mental health care as well. But, and I'm happy to talk about that a bit more too, although I'm also happy to let other people
Go ahead. Actually, if you could take a minute to tell us more about that.
Yeah, one of the most interesting people I talked to was a man by the name of Omar Patel, who works at the University of Toronto Scarborough, and he He is he works in pastoral services, so he is an imam, but he's also a trained psychotherapist. So he has both religious and he's both divinity training and psychotherapeutic techniques, and he brings those things together. So he mixes his chaplaincy work with his psychotherapeutic expertise. And one of the things that was so interesting about my conversation with him is that he pointed out that there were things that he may understand as a Muslim chaplain that a sort of Western trained, Western educated, non-Muslim psychotherapist might not understand. And he sort of challenged me a little bit. He said, if you were a Western trained, non-Muslim psychotherapist, what would you say to a Muslim student who is struggling to make ablutions for prayers because of OCD and it's taking too long? Or what would you say to a student who wants to sever relations with an abusive partner or an abusive family member, but also wants to honor the Prophet Muhammad's exhortation to love and forgive one's kin? And these, I think, are questions where a Western-trained, non-Muslim psychotherapist might come up short. And this, to me, speaks to the importance of starting to hire people whose expertise match the demographics in the student body, and starting to think outside of the sort of more narrow confines of the Western psychotherapeutic model, which is not to say that I have anything against the Western psychotherapeutic model. I think it's incredibly helpful for a lot of people, but a more diverse campus requires a more diverse approach to mental health.
Oh, interesting ideas. Liam, I'll get you to jump in. What are some approaches that you see that are savvy and work to deal with the actual situation on the ground?
Certainly. Well, a lot of it is being touched upon. I think having that accessibility is certainly a key. I myself have experienced the runaround that students often get when they're trying to seek these kinds of services, or for that matter, any service. It seems like from their post-secondary institutions at times. Often there are those long wait lists. There's often a labyrinthine bureaucracy. They don't know whether or not to go to their student association for help or their school. For example, our health and dental plan offers strong counseling support, but I walk into classrooms and ask them I ask students if they were aware of it. They just aren't. And that's, a failure of messaging sometimes on our part, but it's also because it's incredibly difficult to reach students where they're at and figure out exactly how they're going to be receiving their messaging. I think something I touch on is really delivery flexibility. I think earlier I spoke a little bit about how some people are really thriving at home. Some people obviously aren't, and we're here to discuss what to do for those who aren't. I think meeting students where they're at, giving students the ability to engage in a post-secondary education in whatever manner that they see fit is something that they really value. There's an overwhelming sense that we are operating within an arcane, old school, very outdated modality of learning that doesn't recognize individual learners. It doesn't recognize authentic assessment, and it doesn't recognize the fact that moving to a city that you don't live in for 4 years is becoming a bigger and bigger ask for young people in this day and age, when they aren't 100% certain that they're going to be coming out of that school with a job. They know they're going to be in debt. These are big asks to be making of our young people. And so making sure that post-secondary education is accessible no matter where you are, I think offering flexible models is something that we definitely need to be looking at.
That's interesting because the pandemic is unfortunate. It's a terrible incident, but it's making us question some of these things and consider some of these things. Joanna, you've talked about some best practices that you would like to see before students even get into the post-secondary scenario. What have you seen on campuses or around campuses that are being tried that you think work?
I think it's essential that student voices be part of the planning for post-secondary education. I think we've long held on to this model of experts in education who plan our systems, and really we need post-secondary students, we need other people, we need people with lived and living experience and expertise of mental health and substance use challenges to be part of the planning of the solutions. Because I think when voices of the people most relevant to the conversation are absent, we design initiatives that can be unhelpful helpful and at times even harmful. And so I think that's essential. I think, as I was saying before, like working together better as a system across, across each jurisdiction, figuring out, because colleges and universities and other post-secondary institutions have also a ton of expertise to offer the local community in terms of the things that are their strengths. And local community have a lot to offer, but we often see quite significant gaps between, like, post-secondary institutions often operate quite siloed from the rest of the community, but students don't live siloed from the rest of the community. So really thinking about how do we work together to solve some of these challenging situations.
Well, there is a question that I want to put to you before we bring in Deborah and Denise for our next segment. Joanna, when speaking of momentum, here is a possible step. Canada's first national standard, actually, it's a global first. It's the National Standard for Mental Health and Well-being for Post-Secondary Students. This was issued just a little over a year ago. There's even a starter kit that institutions can access for a framework in approaching solutions. What impact has this national standard had in strengthening the programs and services on campus?
So, I mean, I guess what I would say is the goal of, like, if we start from a big vision and we say we want all post-secondary students across the country to be able to have access to the same kind of quality experience and the same kinds of supportive mental health experiences when they engage with post-secondary. I think that's essential. I think, from an equity perspective, from a resourcing perspective, we are strengthened when we all work together and we articulate these kinds of big visions. I think what becomes challenging, and I wasn't involved in the creation of this standard, so I may be saying things that aren't totally aligned with how it unfolded. But I think my previous point, we really need young people, we need post-secondary students to be part of the process in the creation of the standards that may or may not have taken place in this case. And then ultimately, we need to be able to easily access these like the materials that go along with it. It isn't just about creating a resource. We have centuries of resources sitting on shelves unused. We need a specific strategic action plan that doesn't only focus on post-secondary, but actually serves to bring together the community and post-secondary institutions into a collaborative system-wide approach to tackle this. We can use those standards, that standard as a guide, but it needs to be easily accessible. It needs to be, there needs to be a plan for how to support that sort of implementation, not just in the post-secondary context, but thinking as a system. Because when many post-secondary institutions are not at all funded to deliver mental health services, unlike secondary and elementary schools where you have lots of resources to support student mental health. When you move into post-secondary, those resources are no longer funded in the same way. And so we really, when you start to do some of this work, you create pressures in other parts of the system. And we really need to be thinking as a system.
That's actually a really big thought, and I think it's the perfect segue to bring in Denise and Deborah. The idea that what is needed here is a strategic national action plan because of how broad and common this issue is. I'd now like to invite Denise Amiot and Deborah Saucier. They've been in the wings listening in. Denise Amiot is the president and CEO of CICAN, and Deborah Saucier is president and vice chancellor of Vancouver Island University. Thank you both for being here. Deborah, I'll start with you. Our panelists have painted a picture of difficulties, challenges, and possibilities. What is your take on what they have to say? Oh, I think I think your mic may be muted.
There we go.
Okay,
The
thank you.
mute button went away. Now it's back. Okay. You know, I don't doubt that what they're saying is true, right? But I would also come back to, what Dr. Henderson said last, and that is that many of us are actually not funded to do this to nearly the amount that we would need to do the great ideas that folks have suggested on this podcast, right? The kinds of things that we're talking about actually take resources and will take a national will to actually fund these pieces and not just do them on the backs of other activities and other things that are happening at universities, colleges, and institutes. The other thing I would say, though, is that I think this is something that every single person in the post-secondary area is concerned about. No one wants to have a student in their office or on campus who is struggling. Everybody wants our students to succeed and do well, and everybody is struggling with this issue. Right? And there's no easy solution. A national strategy would be great, but without the resources to fund it, it remains a dream rather than a reality, right? And we need to get serious about mental health and actually resourcing it. Not everybody lives in Toronto or Calgary or Vancouver. I mean, it feels weird to say that Nanaimo, where I am, is a rural and remote community, but there are wait lists of up to 2 years for pediatric psychiatrists. And sometimes it's even worse if you're an adolescent because you fall in between that. And so for emerging adults, like the sort we use or serve at university, it can be tremendously challenging if you have a serious illness, and if you have what some people might consider a less serious illness like anxiety or depression, which is not to say that it's so, that's even less serviced in communities that are small, rural, or remote.
You know, Deborah, in an earlier conversation that we had, you this was really insightful for me. You described to me the change in the population and the demographics of of who's on campuses across the country. I was hoping that you could take a minute to share that with us because you did it in a few sentences, and I learned a lot from.
Sure. So in the late 60s and 70s, when my dad went to university, right, the population was equivalent of all university learners across the country, equivalent to three of the largest universities in Canada, the University of Toronto, UBC, and McGill, added together for all of them. And almost everybody who was going to school was middle class, white, and predominantly male, cisgendered. Right now, we're dealing with a large number of first-generation learners who come from a variety of different ethnicities, who have all kinds of different needs, who have come through a K-12 system that has changed significantly since the 70s, and the post-secondary system has not been resourced to change with it. The age is older. A 4-year degree isn't 4 years anymore, right? It's 5 or 6. Often people go on to then reskill or upskill across their career, coming back more than once. So our average age on campus is getting older. At colleges, I understand from talking with Denise, the average age is 27. Most universities think they deal with the 18 to 23-year-old demographic. That's not so, at least not for my institution. And the needs are more complex. More and more of my students are working full-time or more than 20 hours a week, and more of them have significant family responsibilities, either to their parents, their family businesses, or to their own children and their own families. So this is a very different demographic than the 18 to 23-year-old. I'll take 10 classes, maybe borrow $5,000, and that's it, right? We see a significant shift in who we are serving. And I call it the democratization of post-secondary. I didn't invent that term. It's well used in the field. But it's a shame that public investment in post-secondary is on a record decline over the time, just as people of racialized communities, equity-deserving groups are finally able to access post-secondary. We start to see this public disinvestment in post-secondary and all the needs that are associated with that.
Yeah, it's interesting that you say that, because even first generation students, we've seen really, those numbers climb as well. And that's another group that is deserving of it, and also needs support. Denise, are there any questions or comments that you would like to add to what Deborah has said, or to really the entire segment so far?
First, I fully agree with what Deborah has said. I want to bring some nuance to what was said earlier by some of the speakers, and it's with respect to students often that are far from their neighborhood. Um, we should remember that when we talk about colleges and institutes, 95% of Canadians live within 50 kilometers of one of our campus, and 86% of Indigenous live within 50 kilometers. So that means that often the programs can be offered in their neighborhood. Not always, but often. And this is something that often people are not aware of and this helps with respect to accessibility. And the reasons why I mention this also is because colleges and institutes are known for their closeness to their communities. When we were created 52 years ago, it was in fact to serve the needs of the community. So because of that, there are a lot of synergies between the post-secondary institutions that are colleges and institutes and their communities. And the other thing that I want to demystify is the placement. Because if you study in a college or an institute, 91% of our graduates find a job within 6 months. And that's why we see such a diversity of students in our institutions. And I call our institution lifelong learning in action because, as Deborah said, the age of our students is 27, the average age, and we have a lot of students coming for upskilling and reskilling. The good news in all that is that post-secondary institutions they are adapting to this topic of mental health, not only in the services that they provide, whether with peers or with apps so that students can find the resources in their communities, but because they teach so many sectors, so many disciplines, they also integrate mental health as a topic. And they do that in two fashions. The first way is that they talk to the students about the patients that they will serve. And when I say patients, sometimes it's clients, whether it is in social work, whether it is nurses, paramedic, or any other field, even as plumber or people in construction. And they talk to them about the people that will have mental health that they may encounter during their work. And they also talk to them more and more about, and for you as a new professional, how will you take care of yourself? Because nobody can say, oh, for me, I won't have any issue of mental health, because you never know what will be around the corner, and that may be not a barrier, but something that will happen that may change the path, not the path that you were on. So I think this is very important to remember.
So we've, over the through the first segment, we heard some ideas for best practices. Liam spoke of making things more humane. I really liked that as a general theme. Simon spoke about hubs. Joanna spoke about a plan, right? Not just a standard. I wonder, Deborah, Denise, if there are best practices that you've seen or promising work that you would like to see more of your colleagues adopt.
One thing I would add, sorry, Denise, you go ahead.
No, go ahead, please.
One thing I would add is that in our most recent strategic plan here at VIU, we actually committed to become a healthier place for work and study, which means we actually have to put our money where our mouth is. And some of the things that we're engaged in is actually some of the things that other folks have talked about. And that includes things like building resilience, how to bounce back after a disappointing result, or how to interpret that disappointing result to actually stop it from getting worse. But also peer-to-peer help. We know that we often talk to our friends before we will ever go talk to somebody else, or somebody that you trust who's professionally trained, like a psychologist or a psychiatrist, a social worker. And so giving those resources to our faculty, to our students, so that you can have a helping conversation and know when you actually need to do it. We say here, don't do what folks have experienced elsewhere, which is send somebody to, well, no, that's not me, go find somebody else. It's like, walk the person over to where they need to be, go help them find those resources, and we'll ensure that you have the time to do that. But that's because we've committed to that in our strategic plan, and I would challenge folks around the country to actually examine this. Nobody goes to university, colleges, or institutes because the world's going to hell in a handbasket. This is a place of hope, and this should be a healthy place to be. And if we are making our faculty and students sick, we are doing something wrong. And we are all really smart people. Our students, our communities, our faculty, I hope, I know people sometimes don't believe this, administrators, we should be able to figure this out and make this a healthy place that actually meets those hopes that people came for to begin with.
Denise.
Some of the things that I have seen earlier, Manjula, you were talking about the health, the standards for mental health developed by the commissions. We were at colleges and institutes and Universities Canada quite involved in the development of those. And so now, of course, what is important is using them, socializing them, having best practice. So there is the starter kit that is available. But what we've seen, in fact, we've announced it last week in our newsletter, Bell Talks had some grants available for the post-secondary. And a number of our members, in fact, were able to take advantage of those. And they, in one case, for example, around the Toronto area, there are 6-7 colleges that got together to develop best practices that are linked to the standards. Cégep de Sherbrooke, for example, is looking at developing specific tools in link with the standards, but again, that are not only serving the students and the staff, but also the community. So those are concrete examples that show that what helps is collaborate also with other post-secondary institutions where you don't have to reinvent the wheel. Like, for example, I know that some institutions had developed apps, but then I saw other institutions using the same framework or structure of the app and adapting it to their own needs. And there's also, and I think it was, I forgot if it was Liam or Simon who mentioned it earlier, but I think it was Simon, because you talked about culture, the importance of diversity and culturally relevant. What is also a very good practice in our institutions is having elders that can support students, because what we are seeing is that often they do not only support Indigenous students, but they are non-Indigenous students, especially international students that go and in fact are able to have conversations with the elders, and it's really helping them. So you can see on our COVID-19 website a specific link to a lot of the best practices that we saw that our members had. And as I said, there's also those micro credentials that are more and more popular that people can take that help them not only to learn for their new professions or what they are studying, but it also helps themselves.
Thank you, Denise. I find the national standard actually quite interesting. So I think we have a couple of minutes left. So I thought that I would give everyone a minute to just share some last thoughts. I mean, this is a really large issue, and you've been really good about trying to fit it all in. But there are certain things that I know that we haven't talked about. We haven't talked about the financial strain on students, just when it comes to tuition and things like that, and what needs to be done there. So what I'd like to do is give all of you the mic. Everyone's going to get about 30 seconds, and maybe Liam, I'll start with you, and then I'll move on to Joanna. Liam, 30 seconds. Any last thoughts here?
Thank you, first of all, for this discussion. It's been very great. I think what was said about the lack of resources is something that I'm sure our viewers, being professionals in post-secondary education, are well aware of. I think the theme that we need to be having these discussions in is a theme of recognition that post-secondary education does not serve the same purpose now that it does when the systems that support it foundationally were built. We are, at least in Alberta, we're expecting to be underfunded by about $600 million. The student loan program, kind of patchworking support for post-secondary students rather than federal funding that was put in place decades ago, simply doesn't work. The value of a degree is on the decline, though we don't necessarily want to recognize it's a very valuable experience, but everyone has that experience. We need to take a transformative and foundational look at the way that we offer post-secondary in this country, on a national basis, on a provincial basis, and even within our own cities, and how learning and universities or colleges play a part in our communities on a local basis. We need to, as a country, as a population, as the most educated population in the history of man, determine how we're going to fund it and how we're actually going to support those that are going through it, because the vast majority of people actually are going through it, and it's only going to get more standardized. So we need to transform the system, mental health being an important factor of it.
Thank you. Take it back to first principles, it sounds like. Said like an engineer. Joanna.
I mean, I would just like to echo Liam's comments. And I think, hearing from students is critically important. I think we really, going back to something Liam said before, we really, my parting message would be, we really need to be courageous and stand and look at, scrutinize our current systems so that we understand how, and I think Deborah was alluding to this a little bit before as well, how our whole system of education, including post-secondary, contributing to poor mental health. And when we think about evaluation, when we think about this sort of historical stance around what it means to have value in society, and how do post-secondary institutions perpetuate ideas of ways to understand value and competency, I think that's where our next step needs to be really examining those aspects of our post-secondary institutions.
Simon?
Yeah, I think maybe for me, the most important thing is investing more money in preventative mental health care and mental health care for people who are just starting to struggle or struggling just a little bit. I think the problem on campus sort of mirrors the larger problem in Canada as a whole, where we don't have a whole lot of money in psychological services, and we don't have a whole lot of money invested in accessible services for people who are just struggling a little bit. We tend to treat people when they have acute crises, but we don't tend to give people the kind of tools early on through psychological services that could maybe enable them to not have the crisis in the first place. This is a Canada problem. I would love to see a much more sustained federal investment in psychological services and services services for people who are struggling with mental health but are not in an acute state of crisis. And then I'd like to see our campuses doing that too, putting more money into serving students who are actually not that mentally unwell as a means of preventing them from becoming extremely mentally unwell. And I do realize that not all of our campuses have huge amounts of money to put into these things. Some of them do, though. We have talked a lot about resources. We've talked about the lack of resources in post-secondary. And I think that is true for some, maybe even many university campuses. There are also other universities, certainly in Ontario where I live, that are quite financially well endowed and could probably stand to be spending more money on sort of frontline mental health services than they currently are.
Fair enough. That's a valuable point. Deborah.
I guess I would just end with, I think that the single biggest thing we can do is prepare folks for the conversation that will happen some point in your life when someone will admit to you that they're struggling, and ensure that they have the resources nearby, close at hand, to get them the kinds of help and supports that they need. And the last thing I would say is that if anybody is struggling out there, pick up the phone, call. Don't suffer by yourself. You're not alone. You're so not alone. There are people who are willing to listen, and there are resources no matter where you are.
Thank you, Deborah. And Denise, I started with you. It looks like I'll be ending with you as well. Any thoughts?
I fully support all the suggestions that were made by all the speakers and Deborah. Maybe I'll finish by something that is important for all learners, and also I would say human beings as a whole, and it's hope and to be engaged, because we talked about engagement earlier. So what I would say is that if a campus can mobilize its students around a cause, whether it's volunteering in the community, whether it's something related to health or poverty or climate change. Very often what we found, and Dawson College has done a lot of not only initiatives, but research on that. And what they found is that if you are able to engage the students around a common cause, those students will do better. They will do better in their schooling and in general with their mental health as well. So there may be something there for all people involved in campus to look at what should be our cause. What do we rally around? What should we mobilize on? And then everybody feels good about themselves and they feel good about what they have given to the community.
Thank you. All great suggestions. Thank you. For everyone listening, I should add that standard that kept coming up, CICAN was proud to collaborate with the Mental Health Commission of Canada and other stakeholders in the development of that standard. It's Canada's first national mental health standard for post-secondary students. You can access it as well as resources to help your institution begin implementing it. You can find information on the Commission's website. You'll see the link right on your screen here. And if you want to stay informed about key developments and initiatives that are led by CICAN, as well as our government and other national and international stakeholders, don't forget to subscribe to CICAN's free bi-monthly newsletter, Perspectives. And as always, tell us what you think. We invite you to share your perspectives, stories, questions, and comments on anything that you've heard today. You could do so using this email on the screen, live@collegesinstitutes.ca. Thank you to our fabulous panel of guests. They certainly kept me inspired and thinking. Joanna Henderson, Liam Hunter, Simon Lucen, Deborah Saucier, and Denise Amiot. And before signing off, I want to say that please stay tuned for more news about CICAN's history and its 50th anniversary celebrations. You can find more about that at collegesinstitutes.ca/50. And we'll be back next month, Wednesday, February the 16th, to be exact, for our next episode of Perspectives Live on this very crucial topic, amplifying Black excellence. Thank you, stay safe, and we'll see you next month.